Well, this week was the deadline for staff at Baptist Memorial Healthcare and University of Mississippi Medical Center in Jackson to get the COVID-19 vaccine.
However, smaller hospitals like Winston Medical Center are still bracing for a decision by the Centers for Medicare and Medicaid Services with concern that their expected vaccine rules will deplete their already undermanned staff. Stephen Pimpo spoke with Winston Medical CEO today.
I do anticipate we will have some people that will leave if this comes down.
That's the reality facing Winston Medical Center and hospitals like it as they await the expected ruling by the Centers for Medicare and Medicaid Services requiring the COVID-19 vaccine.
To say the least, I'm a little bit concerned. I mean, we haven't had 100% participation with the vaccine here by our employees or associates. Last I checked, it's somewhere around the 55% range.
Back in September, CMS expanded their vaccination requirement for all healthcare facilities receiving their funding.
There's not a healthcare facility or operation that I can think of that can operate without the Medicare and Medicaid funding.
To do that, they're changing their conditions of participation. The rule requiring COVID-19 vaccination for healthcare workers at Medicare and Medicaid facilities has already passed the White House review and will go into effect as soon as it's published by the Federal Register.
When the ruling first came out that was only related to long-term care facilities, there was concern there for us too, because we have a long-term care facility that we just have a wholesale people just leave and go work somewhere else in healthcare.
Now, Winston Medical CEO Paul Black fears the same thing will happen on an even larger scale.
The concern is that there are going to be some portions of the healthcare market will just say, to heck with it, I'm getting out of healthcare, I'll go work somewhere else.
Black expects it to be the latest blow to an already dwindling workforce.
We're hoping that as the virus wanes throughout the country, a lot of these healthcare workers that have gone on a contract and gone somewhere else will come back to the state. But, you know, we may be in a position where it may never come back to normal.
In Louisville, Stephen Pimpo, WCBI News.
After CMS proposes a rule change, there is a 45 to 60 day period for them to gather feedback before the rule is finalized.